accident and emergency. Sister speaking. Can I help you?
Matthew Hughes, please.
It's mid-afternoon at Alder Children's Casualty Department. Mike Callahan is the charge nurse on duty.
And either put Matthew on your knee or on the bed. Whatever he feels most comfortable in doing. Let me just lower it. So Matthew swallowed a screw, is that right?
I did, yeah.
Did you actually see him do it?
My mum.
I could see just the end sticking out of his mouth, and I tried to get her. I said, "Spit it out, Matthew," and just swallowed it right down.
So the screw we're looking for is about this size?
All I could see was this
I
coming
see.
out of his mouth.
Do you like screws, Matthew? You prefer nails or something? Doctor's just next door, Mum. She'll more than likely send your son off to X-ray. OK.
Dr. Tina Sajanha has been called to 3-year-old Annie Taylor, who says she can't move her arm.
Do you want to tell me what actually happened?
She was playing in the garden and she fell off the slide, and she's fell onto the grass on her arm. I don't really know how she done it because I was doing my dishes.
Did you fall?
Get off the slide.
Or did you fall right from the very top of the slide? Or from near the bottom?
To the bottom, didn't I, Dad?
Yeah.
Where you swam up.
Off the steps.
Up the
fall off the
steps?
steps?
You fell from near the steps?
Or did you fall on the ball?
When you were going down?
Yeah.
Oh, right. Annie, whereabouts is it sore? Can you show me?
It won't get better then, will it?
Tell you what, I'll have a very little look at it just to see how it is, all right? And then I can see if I can make it better.
Right, can you see my light? Can you see it? It's going to take your picture. It's a magic light, isn't it? Hey? OK, Matthew. I'm going to stand over there and push a few funny buttons. OK. You're going to listen now, because it's going to make a funny noise like your mummy's washing machine. OK.
Does it hurt around the back here anywhere?
No, there.
Just there? You're ever so brave, aren't you?
Yeah.
Is it sore when I do that?
Yeah.
Can you turn your arm round at all?
No.
Should we just have a go? You gonna try?
Yeah.
Oh, look at you. You're so good. Wow. You're best patient today, you know. Whoa, what a girl.
It's getting better.
And I want you to put your arm right up in the air. Well done.
Do any of this before, would she?
Can you put your arm around the back like this, like you're going to scratch your back?
And if you gave us a false alarm?
Very good. I think your arm's better now. All right.
Thank you to the
Thank you.
That's quite all right. Shake hands with me. Yeah.
The search continues for the screw that Matthew's grandmother saw him swallow.
Can't see it.
I don't know where it's gone.
I think he must have spat it out. It's not on the X-ray.
Right.
If he starts getting tummy pain or something, then and it doesn't settle, then bring him back. But
OK.
I don't think he swallowed it.
OK.
Okay. All right.
Sorry for wasting your time.
No, that's all right.
Bye.
Kids will swallow absolutely anything they can get their hands on, right in their mouth. And most people think screws are quite dangerous because of the pointed tip. But 9 times out of 10, in that end, out the other end, no real problems really. And Mum done the right thing bringing him along here, even though we all know after X-ray he hadn't swallowed it. She's certainly done the right thing bringing him along. So it's probably at home on the carpet now, waiting to be eaten again by someone.
Not done at all.
Come on, then.
I don't know which one it was. I don't know.
What does that mouse say? I don't believe it.
Up on Alder Ward N2, 6-year-old Lucy Collins has been admitted. Lucy was born with a heart problem which is now causing dizziness. Most 6-year-olds have a heart rate between 80 and 100 beats per minute. Lucy's heart sometimes slows down to 29. Consultant cardiologist Dr. Ian Peart will operate on Lucy and fit a pacemaker to prevent the dizziness becoming blackouts. Around 20 pacemakers are fitted at Alder every year, some into children only 2 weeks old.
When the operation's finished, the pacemaker will be just up here. Yeah. OK? And then, using X-rays, we feed the electrode through the circulation into the heart. Now I just need to have a sort of private chat with you. Shall we just pop through into here and we can have a seat in here? And just... In order to put the pacemaker in, we've got to get into a vein behind the collarbone. Now, in order to do that, you have to actually put a needle behind the collarbone to get into the vein so that you can actually pass the wire through it. Okay? There is a very small risk when you do that you can pop the little membrane that covers the lungs. I think the important thing from your point of view is that she'll come back in the same way she went down, except she'll have a pacemaker in when she comes back. If you give a patient a risk of 10%, that sort of gives some sort of idea of how straightforward the procedure is. I think the unfortunate thing is that if anything goes wrong with any child, then the risk is either 0 or 100. You can't give a parent 90% of that child back.
I go in a few times at night and I touch her dead nervous, you know, because I'm thinking something's wrong. So I suppose I'll not be able to, you know, I'll be able to relax on that now as well. Because, you know, sometimes she even looks like she's not breathing and I'm just nervous of the operation now. I never wanted the day to come. I mean, I knew it'd have to, but I didn't want it to. But it'll be better for Lucy once it's done.
It's 10 o'clock in the evening. A team from Alder Intensive Care Unit has collected 2-year-old Adam Horbury from Glenclwyd Hospital, 60 miles away in North Wales. Early this morning, Adam developed a rash. When his mother took him to their doctor, meningococcal septicemia was diagnosed. Adam was immediately given a dose of penicillin before being admitted to Glenclwyd Hospital's intensive care.
Hello, Mrs. Hope. Hello, Sister Roberts. How are you, Mrs. Alder?
Meningococcal septicemia is a severe infection of the blood caused by the same bacteria that can also lead to meningitis. Some children die only hours after the first rash appears. Jane Ratcliffe and her specialist team in paediatric intensive care will continue the work started at Glenclwyd's adult unit. Adam has been sedated, paralysed and put on a ventilator to allow his body to fight the effects of the blood poisoning. The team must monitor him so they can respond quickly to any changes in his condition.
Meningococcal septic shock causes bleeding into the skin, and so this is actual bleeding into the skin, this rash that you see. I'm stretching the skin and the rash doesn't go away when you stretch the skin, it doesn't blanch. And you see it looks a bit like little bites in some places, but if any parent sees that, they need urgent medical attention very quickly.
Here's your little friend Tom.
Adam's parents have now arrived from Wales.
Anyway, you were worried.
They couldn't tell me anything. I kept asking, you know, is he going to be all right? And they were just saying, you'll have to wait. For the first 2 hours, I wasn't allowed near him. They didn't tell me nothing.
Yeah, it can go very quickly sometimes, and children become unstable, and that's why they were so aggressive in their treatment, and because they, like us, have a great respect for managing this illness aggressively, because it can go bad very, very quickly. He certainly doesn't seem to be developing any more spots. You say that you saw some last night. Were they the ones round the tummy that you saw last night? But he wasn't himself, was he?
No, not at all. Yeah. He couldn't even move. No. Picked him up and his body sort of just flopped.
And what was he? Did he sleep overnight or?
No, he was up most of the night.
Yeah. What was he like?
It's just whimpering, really.
Yeah.
Blood, plasma and other fluids will replace what Adam has lost and help maintain his blood pressure.
All finished now, all finished.
Overnight, the team has been pleased with Adam's progress and he's been weaned off the ventilator. He's now breathing for himself and his blood pressure has stabilised.
They took the tube out this morning, so it's been breathing ever since. It was quick recovery, really. You know, they said they've had other cases where it's been a lot longer, but they decided to give him a go and touch wood. He's been all right. He's pulled through.
Adam will continue to be given antibiotics, which will completely kill the bacteria. In the cardiac theatre, preparations are underway for the 2-hour operation to fit Lucy Collins with her pacemaker.
There's a pacemaker, yeah.
I'm Dr. Booker, I'm the anaesthetist, and just been reading Lucy's notes. And basically it's a viral myocarditis back in 1990, and since then she's had rhythm problems.
Yes.
And having a pacemaker in today.
Yes.
So we'll give her a pre-med, some medicine to drink. That'll make her a bit sleepy. And then when she gets down to the cardiac catheter room, we'll get her off to sleep. And presumably one or both of you are coming down to see her off to sleep?
Yeah. I am, yeah.
You're coming.
Can we both come
You can
down?
both come, yeah,
Yeah.
sure, yes. More the merrier.
Best thing to do is just tip it all the way back and drink it all in one go. Good girl. Just down the hatch. Good girl. Brilliant.
Well, I'm supposed to be going out to Harry Ramsden's
How are you?
for fish and chips.
Enjoy the fish and chips.
Very much looking after my coronaries. Here
You
she
can hear
is.
the crying coming out the
She's coming
corridor.
now.
She's arriving.
Don't forget your bracelet, Lucy.
Lucy's heart rate is slow because the electrical connection between the upper and lower chambers of her heart is missing.
That's the thiopentone in, and now we're giving her the paralysing drug now. And she'll be going completely floppy now.
Okay, Dad, do you want to let her go down? Sorry.
Electrodes attached to the pacemaker will connect the chambers and allow her heart to beat at a normal rate for the first time.
Thanks, Dad.
She was perfect in the injection.
Can I give you a little kiss?
Okay.
So it's all peaceful now.
Whenever a parent's child is undergoing an operation, doesn't matter how much you reassure them, I'm sure that they often think, well, more about the things that can go wrong rather than the fact that it's going to run very smoothly. I don't anticipate any problems.
I know, it's a lot for you, but she will be all right. She'll have a lovely dream. That's what you always tell them to have.
Ferris Howard, please. Hiya, Ferris. What are you doing here today?
I don't know, I've got this problem with my knee and it's hurting. I went to my GP, she gave me, because I had an infection in that knee, but that's cleared up, so she gave me more antibiotics and painkillers, but I finished the course, so mother said to come to the hospital. She usually comes with me, but she's got the flu.
Okay, doctor will be with you shortly.
Hello, I'm Tina Sargent. I'm one of the casualty doctors. What's the problem? You've got pain across your knee, is that right?
It's like it's coming out of place or something.
Right, okay. Have you hurt it at all?
No. It might be the tibia.
Right.
Maybe that, but I don't know.
Well, you know all these medical terms. How do you know all these? Have you been reading some...
I broke my tibia, my right one.
Oh, right.
Ice skating.
Oh, dear.
Crashed into the wall to stop myself. And
how long ago was
fell
that?
behind. I can't remember, about 2 years ago.
Oh, dear. And what happened to you?
Made me scars. When I was about nearly 3, it was a Sunday morning and it was cold in the winter. And my mum put an electric fire in the room and I threw my teddies at it and I went back to sleep again. And they set a light and then the whole room and the door was jammed with the smoke. So sustained 90% burns my body. I can't remember what degree it was. And my father opened the door and got me out. And I was in intensive care for a couple of years. Well, not years, about a year.
Okay, I'll be there in a second.
Just checking your address first. Do I really live here?
Who am I?
Who am I?
He's right by me.
What's the school?
Southfield Park. I go to 2 though, Southfield Park and West Derby.
Why 2?
When I first got scarred, my mum sent me to there. And when I got this thumb was like that. And they released that, they made it stronger and helped me use forks and stuff.
Okay, let's look at your hands. You have no fingers?
No.
On both of them?
Just ends.
And how about toes?
Got them.
You've got all your toes? So kick a ball then?
Yeah.
With great force?
In the cardiac theatre, Ian has made an incision below the collarbone on Lucy's left shoulder.
I think we now have a pocket which is big enough to take the pacemaker. So the next step is to find somewhere to put the electrode. So what we have to do now is get into a vein behind the collarbone, and through that we'll get leads into the heart.
Because the vein is behind the bone, it's not visible, so locating it can be a difficult procedure.
I'm having trouble here.
After a quarter of an hour, Ian has still not been able to find a vein that can be used to feed the pacemaker's electrodes into the heart.
I lay awake last night thinking the worst, thinking what if they come after the operation, you know, told us something had gone wrong, and I was thinking that all night. And, yeah. What time is it now? We should be hearing something in the next half an hour, I would think.
And release the table.
Ian has now found the veins and passed 2 wires into Lucy's heart to help guide the electrodes into position.
Over that wire you can pass larger introducing sheaths so that we can actually put the pacing electrodes in. This is one of the pacing electrodes. It's just like wet spaghetti. This electrode has little fins on it, and that will sit in the bottom of the pumping chamber and will pace the ventricles. And inside here there's a little screw which, when we've got the electrode in position, by turning at this end we can actually extrude the screw and it will actually lock itself onto the inside of the heart. So the first electrode is now in the circulation. So we now have one of the electrodes sitting in the bottom of the heart. That will pace the pumping chamber. Now passing the second electrode and then using some rotation. And now, having got it into that position, we need to screw it in. And essentially what we do is use a little device which fits onto the end of the electrode, and then we rotate it to unscrew the tip of the electrode in the heart. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And as you see now that the screw has actually emerged from the electrode and now will hopefully be screwed into the wall of the atrium. That looks reasonably good.
Do running for the disabled every year, but I'm afraid that my knee might restrict me now. From when it was dead good in Blackpool last year running. I tore my hamstring in the 100 metres, just as I was winning as well. The final, an inch away, and then they all went past me as I limped across the line.
Down here at all?
Just tingles.
You haven't injured your knee at all? You haven't hit it against anything? You've got more swelling at the bottom of this knee.
Yeah.
Did you see across this knee, you've got no swelling down the bottom. But on this knee, you've got all this...
puffy stuff.
Yeah, you've got all this puffy stuff. Probably the best thing to do is if we treat this inflammation first. I'll give you some medicine which we call Brufen, okay, which is like an anti-inflammation type of medicine.
Yep.
Yeah? All right. So I'll give you a prescription. Now you'll need to go and pick up the prescription and we'll put this support bandage on for you.
Yep.
All right?
Okay.
I'll give you the prescription, but your mum has to come up with you to pick up the medicine. All right?
It's where he lives is kind of on my way home. I mean, I can drop him off if you want. What do you think, Faris? But that won't be till 4 o'clock. And I'll tell your mum what's going on.
Yep.
How about that for community care? Hey?
You deserve a raise, don't you?
A raise or a rise? Right, listen, have you ever had this on before?
This is tubercle.
You know everything here, don't you?
Yes.
So no doubt you've had it on before, is that right?
Yep.
So, you tell me what you do with it overnight.
Wear it.
Wrong. You only wear this in the daytime, and just before you go to bed, take it off. Now, when you put it on tomorrow morning and all the mornings after that, Forrest, it must be put on like that. You want it to squeeze all there.
Yeah.
So,
squeeze.
It must go on like that. Get yourself dressed. Can you manage by yourself?
Of course.
Of course.
I'm no old man.
Faris, you're going to need to rest that as well. So no playing footy until you see me next Monday. All right?
That's terrible.
I know. It's
6 whole days. It's a crime. Oh, that's terrible though. Football's good. Not even a little bit. Can I be in goal?
Just make sure we don't get them the wrong way around.
With the electrodes fixed into Lucy's heart, Ian attaches the pacemaker. This will provide the electrical current to stimulate her heart and make it beat correctly. The battery should last up to 8 years before it'll need replacing.
The pacemaker's now working. Okay, so we'll now implant the pacemaker into the pocket, and we put the excess electrode behind the pacemaker. And we do that so that when we go in the future to change the pacemaker, we don't actually cut through the electrodes. They're safely tucked behind the pacemaker battery. Now simply a matter of closing it. As you can see, there's a small lump on the chest. It's not particularly obvious. And as she gets older, that'll become even less obvious. Hi. We finished. Everything's fine. We had 1 or 2 minor sort of technical problems at the beginning, but once the electrodes were in, we got them into the heart fairly easily. Now, she's in the recovery room now. She's asleep. You know, she's, well, dozy, but if you want to come along and be with her, then that's fine.
You both come?
Can just one?
I don't see why you both can't come. Want to come along?
Yeah, please.
Lucy?
Luce, open your eyes to get a surprise.
Here's your mum and dad.
It's Mummy and Daddy, Lucy. Lucy.
Should be probably very much like this for the rest of the evening, I would think.
There you go, look. I am awake and I can hear you, but I really can't respond very well because I'm too tired.
Okay, so I'll see you tomorrow morning.
Yeah, thanks.
Okay. Okay, Paris. So go and take a seat in the waiting room.
Oh, the weight room.
All right.
Hello.
But don't go too far.
Oh.
It looks pretty good. Hello. This is your friend.
It's 24 hours since Adam arrived in intensive care with meningococcal septicemia.
We may have finished all the treatments he needs as an inpatient here, so he may stay just here and go back home.
It looks good.
He's very good. He says, I don't like all these people. If I shut my eyes, they'll go away.
Leave him alone for a bit, but good, that's good. Okay. Excellent.
Just 15 hours after her operation, Lucy is up and about.
How are you feeling today? Well, it's working. How's your arm? So we'll take her off the monitor now. Okay? You look very well.
She does, it's incredible. Done a good job there, Dr. Bird.
Has Panda got hers as well?
Yeah, Panda had one for last night. to do the
I think
other.
my stitch works a little bit better than that.
Lucy must now undergo a series of detailed tests to finalise the settings of the pacemaker.
What we've been doing there is we've just been checking the pacemaker to make sure that it's still functioning properly. So what we do now is we program the pacemaker so that there's a safe leeway for when she goes home tomorrow, so that the pacemaker will work perfectly well until we see her again in a couple of weeks' time.
And how do you program it?
We just put a special magnet over the skin above the pacemaker. The magnet will then talk to the computer chip inside the pacemaker and we'll change everything automatically.
Oh, right. So that's simple then.
Very easy.
Yeah.
And it doesn't cause any discomfort.
Oh, right. Thank you. You said something.
Adam is well enough to be moved off intensive care and onto a ward. He should soon be allowed home and is expected to make a full recovery from the meningococcal septicemia.
We thought it was the end of the world, didn't we?
Yeah.
You know, just the thought of our little boy being taken. I don't know, I suppose we were thinking the worst throughout it, but he proved us wrong. Didn't he, darling? I don't know, it was quite shocking.
In Casualty, Mike Callahan is back on duty.
OK, Robert. Some salt water just to clean your cuts, OK, mate? How did you do them, Rob?
Catching frogs.
Catching frogs?
I fell on a brick and loads of glass.
Where was the brick and the glass?
But the thing, by someone's fence.
So what are you going to do with the frogs?
Didn't catch none, I was chasing it. I was running after it and then that's when I fell over.
Looks a lot better, doesn't it? Let's do this one now. That's it, just go down. That's it. We've got quite a few here. These all from today.
Yeah.
It's quite dirty, that one. There's Dad back, as he was collecting frogs.
Yeah.
After 3 days, Lucy can go home. The pacemaker means she can now lead a normal life.
I don't know if it's working or not to see it's working, do I? So I just have to relax with it, I suppose, and get confidence that it's doing its job. I mean, when I've worried about her for 6 years, I suppose it'll be a bit hard to adjust in one go that you don't have to check on her and everything. So, but once I'm confident of it, I'll be OK.
Robert, should we put a zip in it? So that when you get home, you can just have a look what we've done. Hey.
Is it done?
Well, you got one in. You've got a few more to go in.
It's not a sewing machine we've got here, Robert. I don't like the choice of button he's put on now.
Whereabouts were these frogs?
Grant Road.
All right.
Grant Road Field.
On the school field.
Were they frogs or toads?
No, toads.
What colour were they?
Green.
Green. They're frogs.
Right, here we go.
Keep it dry and keep it clean, yeah? Don't take it off to show your mates. Yeah?
Paul will probably still
Your mates will
buy
just
ours.
have to wait till it's all healed up. OK, Robert?
Is Alec walking like you?
And leave the frogs alone.
Is Alec walking?
Yeah, he's OK to walk, Dad. Certainly no sport.
Yeah.
All right? And if he's going to go to school, then you...
Oh, no, I don't think he'd be going to school.
If he does, you really need to tell him not to go running around in the playground, anything like that. OK, Robert? Look after yourself.
OK, thanks
We'll see you when you come back next week.
Yeah.
Bye, Robert.
Bye, Robert.
Bye. Well, that's me done for today. Off in 2 minutes.